Happy Sunday everyone! Magandang araw po sa lahat ng mga nanonood at nakikinig po sa atin. Si Alvin Elchico po ito. Welcome po sa Thank You Doc. Hindi po kumpleto ang araw natin o ang programang ito kung wala ang puso na Thank You Doc. Ate B, Bernadette Sembrano-Aguinaldo. Hi Ate B!
Hello, Vit! Good morning! Sana okay ka? Okay ka?
Yes,
okay?
okay po tayo. No po. Kaya lang ang daming negative po na balita. No po, di ba parang may streaks pa ng violence. Siyempre, siguro naman by this time, alam niyo yung nangyari sa Ateneo. Ano po, may barilan. Akala mo sa Amerika lang nangyayari, pero nangyari po sa atin. At tapos yung tatay pa ng suspect, binaril din naman sa... Alam mo yun, yung things like na may violence sa gitna po ng COVID virus. May COVID pa, may dengue pa. Ang daming negative na pumapasok sa atin everyday. Kaya yung iba po, nade-depress. Yan ang pag-uusapan natin. Depression. Clinical depression, hindi yung kaartihan lang. Ano sabihin mo, parang I'm so depressed today. Parang I don't wanna get out of bed. I wanna lie down. No. Hindi po. Pag-usapan na natin, seryosohin na natin. Clinical definition ng depression and how to deal with it and why it's happening. Ate B?
Totoo. Kumusta ang ating mental health? Hindi lang ho clinical na pagtulong sa ating mental health, kundi alam ko may mga bago na ring innovations when it comes to mental health. Kaya kapiling po natin ang psychiatrist nating kaibigan, Dr. Babes Arsenas. Tokayo, magandang umaga sa iyo.
Ay, Tokayo, magandang araw sa inyong dalawang mga kaibigan kong magaganda.
Bakit ganon? Bakit ganun? Kada mag-guest natin si Dr. Bernadette, parang pabata siya ng pabata, na parang paganda ng paganda.
Wala siyang problema.
May problema tayo kasi ako kasi patanda ng patanda. Pero si Dr. Bernadette, bakit ganun? Parang baliktad. Benjamin Button, ikaw ba yan? Bangs na nagdala, Doc, no?
Bangs lang yun. Oo, kasi nga nahirapan akong kinat ko na.
At tinan mo, Ate B, yung cheekbone ng lola mo, ha? Mukhang inspired ng lola mo, ha? These days, mula-mula.
Ay, nako. Ganyan talaga pag walang problema.
Namiss ka lang namin.
Miss ko kayong dalawa. In all honesty.
Kami din,
Doc. Kailangan mo kaming turuan kung paano dalhin ang problema, ang depression, paano natin i-manage ang ating mental health. Ganun na nga ba? Hanggang ngayon ba talagang malala pa rin ang depression, Doc? 2 years after the pandemic, nakakalabas na tayo. Kumusta na ba ang ating mga kababayan? Kumusta ka na rin?
Alam mo, okay naman ako, no, sa psychiatrist and dealing with the patients who are having problems and issues. Ang problema lang, para ang dami-daming mga kaso ng anxiety tsaka depression. Ang mahirap kasi hanggang ngayon nandyan pa rin siya. And it's affecting not only us, but everyone. Hindi siya yung bang ang elderly lang naapektuhan. Hindi, tayong lahat.
Okay. Sige, Doc, siguro differentiate natin. I-start na natin yung discussion natin, Ate B. Tapos, we'll move forward with the technological advances as what you said. Pero isa-isahin na natin. Anxiety, let's begin with anxiety. Nabanggit mo may anxiety, di ba? Please define anxiety.
Ang anxiety kasi, i-simplify ko na lang, ito yung mga uncontrollable na worries, nag-iisip ka, na wala naman talagang mga dahilan. Although there will be stressors involved, pero yung parang feeling mo na parang ligaga ka, parang nagpapanik ka, para kang feeling mo mamamatay ka, feeling mo lang yun because of the panic attacks, pakiramdam mo, grabe ang kabog ng dibdib, tapos nanginginig ka, tapos nanlalamig ka, feeling mo imbalance ka, no? Parang hindi ka makakatayo na diretso. Tsaka yung pakiramdam mo na parang may impending doom na, oh my God, mamamatay na ako, oh my gosh, ganun. So, there's a kind of a panicky mode.
And what causes it?
Madami kasi Alvin, if you look at the current na reason, unang-una syempre yung pandemic, pangalawa yung mga problems, no, psychosocial problems na nangyayari sa paligid. Like for example, nawalan ng trabaho, na namatayan, no, nagka-problema sa issues about money and children, no? So alam mo, sa totoo lang, itong pandemic, grabe, parang nag-sprout ang dami-daming mga issues about mental health.
So anxiety po yun, hindi ho ba? Yung
Yes.
anxiety at panic attacks, pareho lang ba? O manifestation ng anxiety ang panic attacks?
Para ang mother hen is the anxiety disorder, Alvin. Tapos ang ano nun, ang mga sub cases doon is meron tayong post-traumatic stress disorder, yung trauma, no? Pwede rin yung trauma kasi mag-occur ngayon because of the pandemic. Meron tayong tinatawag na generalized anxiety disorder, yung bang araw-araw lang parang feeling mo so worried ka about a lot of things. Dati kasi ang obsessive compulsive disorder kasama doon sa anxiety disorders, pero ngayon hiniwalay na siya. Ito yung sobrang linis.
Okay. Yung OC. So hindi natin muna pag-usapan yung OC. That's i-separate topic natin yun at a later episode.
Yeah.
Concentrate lang tayo sa anxiety. Anything else that you would like to add sa anxiety before we go to depression? Because depression is actually mas malala kumpara sa anxiety, di ba?
Actually, pareho din silang malala, Alvin, no?
Talaga? Okay.
Parang na commercialize na kasi ang depression as more serious because of the threats of hurting themselves. Pero naman sa totoo lang, pareho lang din naman ang degree nila, no?
Oh, no way. Totoo?
Yes.
Akala ko
mas malala ang depression eh.
No, you can have severe forms of anxiety also, Alvin and Ate B. Pareho lang sila. Although, parang as I've said, parang serious ang depression kasi nga may mga attempts. No? But
may mga attempts too.
Yes, may attempts or hurting oneself or wanting to die. Okay, siguro sinasabi niyo malala siya, but actually, both of them can really be serious also.
Okay.
So anong delineation ng anxiety at depression?
Okay.
When does it become anxiety? When does
That's a
it
good
become depression?
question. Actually, kasama din doon sa anxiety is phobia, phobic reactions, no? Pero siguro mas later na yun. Ang depression naman ay according to the DSM-5, no, yung Biblia namin, dalawa ang criteria na kailangan nandyan. One is sobrang lungkot that happens almost every day for 2 weeks.
Okay.
Tandaan niyo yung word ng duration, 2 weeks. So kung 1 week lang yan, hindi siya pwedeng minor depressive episodes. Pero yung clinical, no, basis for the diagnosis is yung yung depressed mood which happens almost every day, every hour for 14 days. You just imagine, talagang ganun siya, steady. Minsan merong konting happiness pero hindi siya naglalast. Bumabalik pa rin siya sa lungkot, no? Ang second criteria is parang wala kang motivation to do things like parang nawawala kang interest. Wala kang motivation on things that you always do or things that you do the most. Wala yun. Nawawala lahat yun. Parang
wala kang gana, lethargic. No, parang ganun daw. Wala kang gana.
Hindi lang walang gana, wala talagang interest na.
Okay.
Oh, my goodness.
Na nagwo-work, wala. Like for example, artista ka, ayaw mong magtrabaho na, no? Or lawyer ka, ayaw mo na mag-appear sa court, no? So, nawawala talaga ang functionality.
Okay.
Yun.
Okay. Hindi lang siya, Doc, sige, sabi mo functionality, hindi lang motivation. Pero para kang wala na, wali ka na, ganun.
Wali. Lobat, walang energy, sinasabi ni Alvin kanina. Ang tawag namin dyan is psychomotor retardation. Para, alam mo yun, yung lahat retarded, lahat slow,
Kahit
lahat mabagal.
Hindi mo rin masabi sa sarili mong gagawin ko to? Asan nanggagaling yun? Nasa utak ba yun? Or may sakit ka ba kaya hindi ka na rin makabangon?
It is an illness already. B. It is an illness already. Kapag nawawalang functionality mo, parang alam mo yung pakiramdam mo na wala na talaga. Ganun na siya. Parang nag-stop na mag-stop na yung tinatawag natin na monitoring sa'yo. Wala na.
Tanong ata niya, Doc, is saan nagmumula I mean, hindi naman siya parang instantly na, tomorrow
No,
Monday.
no.
Dapat
Remember,
may trigger.
remember, ganito yon. Tama ka, Alvin. There are triggers, no? With depression. But at times, pag chronically depressed ang isang tao, kahit walang trigger. Okay? So, yun ang mas mahirap. Kaya, kailangan talaga ng treatment right away. Triggers, okay? Yung tanong nyo kanina, what are the causality, no? Or ang reason kung bakit nagkakaganon. One would be, meron tayong tinatawag na familial predisposition. Ibig sabihin nun, sa pamilya, mana-mana. Parang hypertension, namamanang hypertension eh, or allergy. Parang ganun din siya. So I would at times compare it with a medical illness para mawala ang stigma. VN. Second would be, as we have always said, ito yung pagbaba ng mga serotonin, yung mga chemical sa ating brain, no? Ang tawag namin dyan is neurotransmitters. So may mga pathway kasi yan. O parang ganito siya. Lahat may pathway. Parang padiretso, ganun. Pagkaroon ng depression, ano yan, nawiwindang umaakyat, bumababa, nawawalang connection, so napuputol. That's how it is.
Ang
Nawawala.
galing.
So kung walang communication, naputol eh.
Natatawa ako. Akala ko yung background mo design lang talaga. So it's meant
Props
pala to
pala yan.
illustrate. Props pala
Ginagawa
yan. No? Galing Ang galing
Sinadya niya yan. Oo.
Nagagamit mo pa talaga sa explanation mo yung
Oo.
background mo
Para
Ang ganda
Para mas simple at maintindihan ng tao.
Tama yan.
So,
Tama
Doc,
yan, Doc. And I appreciate it.
kumbaga,
Sige, TV, go.
it is also physical. It is very
Yes.
much physical. Pwedeng somewhere in your brain, alang connection. Pwedeng
Yes.
ganun yun.
Ay.
So, ano ang remedyo for depression? Gamot ba? Meron bang operasyon para dyan? Ano ang makakatulong sa isang taong malala ang depression?
I'd like to thank pala si Ate B for joining us dun sa kapiyan sa Philippine Psychiatric Association. We really, we are so, so enthusiastic na nandun yung mga friends. No? So we are connecting kasi the media and our society. But anyhow, madami na tayong modalities ngayon, D and Alvin. Hindi lang gamot. Dati kasi gamot lang. Inom ka ng gamot. Ayan. Pwede ka na, umokay ka na. Ngayon hindi na. Madami na tayong treatment modalities. Well, una would be, syempre, yung very dependable tayo sa mga medications. So, pag depression, wala pang injectable, no? Ang injectable, para sa mga problema sa pag-iisip, katulad ng schizophrenia, may injections na tayo doon. But, promising din, kasi may mga injections tayo in the market na ngayon na ginagamit ko rin for depressed patients na may mga konting psychosis or rumination of thoughts. Ibig sabihin yung isip ng isip na very suspicious or paranoid. May binibigyan na tayong ganon. So, hindi lang tableta. Okay, so tablets, injectables. Meron tayong tinatawag na electroconvulsive therapy or ECT. To simplify, ang tawag doon is kuryente, no? Kung napanood mo yung Beautiful Mind, naglalagay sila ng electrodes dito on the temporal area.
Yes.
And then we simulate a seizure, attacks together with anesthesia. For the purpose of, kasi alam mo ang ECT kasi actually luma na treatment for treatment-resistant depression, for mania, and for patients who are homicidal. Yung severe na yung mga symptoms nila.
Okay.
Yun
So, kinukuryente. Okay. Tapos, pagkatapos nun, masaya ka na?
No. It would be a series of ECTs. No? Depende. May iba, they would have it about 6 times in every other day. No? So, that really helped na mawawala ang mga thoughts. So, napansin,
Hindi ba anong tawag doon? Yung parang nauuto mo yung sarili mo dahil naisip mo may treatment ka. Anong tawag doon, Doc? Hindi ba ganun yon? uminom ka ng gamot, feeling mo nagwo-work kaya natutulungan ka din. Placebo effect ba yung tawag doon?
Ay,
Meron
yeah.
kayang ganon?
The placebo effect naman is that may pinapainom sa'yo, pero wala siyang, hindi siya, like for example, vitamins lang pala siya, pero ang sinasabi nyo is, but the placebo control kasi is usually used in researches, no? But honestly, ethical issues are bounded with the use of placebo in the treatment of psychiatric disorders. We usually do not do that.
Okay.
Iba
Yes.
naman ito, iba yung treatment. Ito talagang kailangan mo. Oo, hindi siya parang kumbaga, hindi siya eksperimentuhan na yung isa bigyan ng placebo,
No.
yung iba bibigyan ng starch, yung isa bibigyan ng totoo. Tapos pag naging effective yung starch, placebo effect yun. Yan ang sinasabi niya. Para
Maybe
psychologically, Doc, 'di ba?
you
Akala mo
are,
meron pero wala.
yeah, but we use that for ano lang, for researches.
Research.
Which is,
Yeah, for
which is
research.
allowable, no? Allowable. Like for example, ang meron mga researches wherein, like for example, may bagong or novel gamot, no? So may mga placebo kami na mga control, wherein yung mga yan, naiinom ng gamot, pero hindi siya talaga for, like for example, for depression. Tapos may isa din
Okay.
naman, may iniinom na talagang gamot.
Yeah. Nabanggit mo yung lahi, pangit man pakinggan, pero totoo pala din talaga yun, yung nagsasabi na may tao talaga, meron talaga nasa lahi nila. At a certain point in some generations, talagang lulusot, may lalabas na ganong klase ng genes, no? So it really is a factor.
Based sa Alvin sa pagsusuri, kapag ang isang parent merong sakit, 25 to 50% chances magkakaroon ng mga offsprings, no? One parent yun. Pag dalawang parents ang involved, it's about 50 to 75% chances. So pataas kung both parents are affected by it. Yeah.
Pero ang kagandahan naman, may solusyon naman kasi. Hindi ibig sabihin na na-depress ka, you will end up in the mental asylum or mental hospital.
No.
You can actually recover from this one intact.
Yeah. Kaya nga maganda tong program nyo kasi it gives us a sense of hope na sadali lang, pag depressed ka, hanggang dun ka na lang ba? Hindi eh. Madami tayong treatment modalities. May isa pa akong hindi nasabi. Later on, I'll explain it to you. May isa pang treatment modality na current ngayon.
Sabihin mo na,
Sige,
Doc.
go.
Okay.
Sabihin mo na, ano yung...
Ang isa is ang paggamit ng esketamine, no? Ang esketamine ay isang anesthesia na ginagamit namin siya pag sa mga operations, sa surgical operations. Alam na mga anesthesiologist to. Although this is this is in the works pa lang. Although matagal na siyang pinag-aaralan, pero parang ngayon may isang pharmaceutical company na nagka-interest na i-open or i-revive siya. So siya para siyang nasal lang, mga spray siya.
So gaganunin. Oo. Tapos kakalma.
Naka 45 degrees ka, Bin. Tapos nostril maglalagay. Yeah. That's about two times a week. Na may mga side effects siya, of course. That's why parang ngayon pinag-aaralan pa siya, although may nakitang positive effect. But however, this esketamine nasal spray, kailangan kasi ng ng recommendation coming from the psychiatrist. Kailangan tuloy-tuloy din ng gamutan. Plus, meron ka rin na iniinom na antidepressant medications para din sa kuryente, para din sa ECT. Pagkatapos ng ECT, hindi lang ECT siya, tuloy-tuloy pa rin.
Itong mga sinasabi niyong mga gamot, Doc, or intervention, kailangan ba siyang samahan din nung mindfulness activity, prayerfulness? Or baka naman pwedeng gamot lang hindi mo na kailangan yung ibang mindfulness activities to beat depression?
For me, uh, the more treatment modalities involved, the better.
Mm.
Family support, and also mindfulness meditation is good. However, yung sa mindfulness, madami kasing mga anggulo pa doon, no? Like for
Ah,
example, if you're more anxious, some would report that they became more anxious because of course there
oh,
will be an awareness. But then may mga pasyente din ako na binibigay ko yung mindfulness meditation like the 3-minute breathing space, no? Nakakatulong naman sa kanila, so case to case. But I think ang pinaka-importante is the patient should undergo also psychotherapy sessions with her psychiatrist.
okay. At
Okay.
gaano kayo
Well,
karami, Doc? Siguro, Vin, para na rin sa mga
sige pala, go,
nanonood,
go, go.
sinong
Go.
tatawagan? Ilan ba kayong pwedeng makausap? Ano, Doc? Is there a hotline?
Yes, we have a hotline for the National Center for Mental Health. I think I can give it to Marla.
Mm.
Also, sa PGH, no, meron din. May mga hotlines kami available for the Philippine Psychiatric Association. We are 600 to 700 all over the country. And 60% are at the NCR and 40% sa Visayas and Mindanao. So, ganun kami kakonte, kay Alvin.
Nabanggit mo kanina sa umpisa na dumadami nga, ano. Hopefully, yung dumadami, hindi yung depression cases, ano.
Mm,
Kasi
mm.
sabi nga natin, pag clinical depression na, kasi joke natin yan na sabi mo, hindi, depressed ako, yung pumasok ngayon. Hindi po. Ang depression is a clinical condition and it needs a
Yes.
clinical diagnosis. Na binanggit na nga kanina ni Doc, ano. Pero sabi mo, Doc, dumadami. Dumadami yung alin? Anong kaso ang dumadami in recent weeks or recent months?
Oh, dumadami yung yung lungkot tsaka anxiety. Base din sa pagsusuri sa ibang mga bansa, itong dalawang to ang notorious ngayon na naapektuhan ang utak ng mga tao.
So ano
Ano,
yan? Ang anxiety and ano yung isa?
depression, yung diniscuss natin.
Ayun. So
Yes,
dalawa
anxiety.
sila parehong dumadami, Doc.
More or less, they are of the same level. Oo.
Okay. Okay. So anong advice mo, no? Lalo na sa mga families na lalo na sa Pilipinas, ano, pag may kapamilya na medyo dumadaan sa ganyan, ano yan, tabu yan eh. Ayaw nilang malaman yan ng kapitbahay, ng mga kaibigan. They don't even want to go to a doctor because they think na kapag may ganyan ka, sira ulo ka eh.
Oo nga
Hindi
eh.
ho, kailangan yun ng doktor na tumulong sa inyo. Paano bang, how to deal with that, Doc? Sa mga family siguro, anong tips nyo? Parents, friends, relatives?
Dapat yung presence nila should be felt, no? Alam mo kasi mahirap talaga mag-deal sa depression. Kasi yung andun yung feeling mo na talaga na wala ka ng pag-asa. So at times, instead of trying to bash them out or trying to bully them or feeling mo umaarte sila, try to look at them in the perspective na they need help, no? Lalo na pag may mga attempts sila, that's not a joke anymore, no? Oo nga, may stigma, pero sa totoo lang, because of the high influx of psychiatric disorders this pandemic, papaano, parang meron konting acceptance on that matter kasi may need eh. Lalo na sa mga COVID patients din, ang taas ng incidence 40 to 50%. Merong anxiety and depression, Alvin.
Oh my goodness. So
That's
kailangan na talaga kayong pumasok. Mukhang totoo nga, Doc. Ano? Alam mo, may case study ako, teenager, diagnosed with depression. And
yeah.
parang sabi ko, ha? Teenager? Eh, di ba mga teenager, ang iniisip niyan, fashion, showbiz, K-pop, and yet pati siya naapektuhan. Ano? So,
Yes.
based dun sa nyo sa experience nyo in recent months, bata ba o middle age o oldies? Sabi mo dumadami yung depressed at saka may anxiety.
Um, the most affected population one are the children and the adolescents, no?
So bata nga.
Nakakalabas eh, yeah. Tsaka they have poor social interaction, physical to Siyempre, online, magaling sila, no? But but then inside the house premises, parang no lessen ng kanilang capacity to interact, no, with their friends, no.
Yeah.
That's one. Second, also the elderly. There are kasi hindi sila punta na sa mga clinics. Although ngayon,
Yes.
meron naman
Pwede
na.
na.
Yes. So para sa akin, importante lang din talaga, let's be aware of the symptoms. Hindi nakakahiya kapag may depression ka at magpatingin sa doktor
Yeah.
kasi para yan, sabi nga ni V kanina I like what she said about yung physical. May physical symptoms ang depression tsaka anxiety.
Yeah.
Hindi
Hindi,
mawawala yan. Hindi mawawala yan kung hindi kayo magpagamot.
tama. And then the fact is, kung dumadami ang pumupunta sa inyo, positive yun. Kasi, ibig sabihin nun, na-accept. Na-accept nila na kailangan nila ng tulong. And that is a major step. Kasi dati, hindi mo ma-accept na, no, hindi ako baliw. Hindi ako si Raulo. Wala akong problema sa utak. Hindi po. Pag kailangan nyo ng tulong, the psychiatrists are there. Diba, Doc? Ate
And
Bigo.
then, the earlier the better magpagamot.
Correct.
Maganda yung earlier the better. Doc, kasi 2 years na yan, nabanggit niyo yung anxiety, no? Siguro ako relate lang ako doon na para ang after the pandemic or at yung sobrang kasagsagan ng pandemic, 2 years after, parang meron kang na nagkaroon ka ng little fears.
Yes.
Chronic na ba yun kapag ganun? O it's actually an opportunity to move beyond that?
Yeah, you can move beyond.
Pero paano gamot rin?
Little fears, if it is persistent and consistent, then it has to be treated right away. Kasi yan di ba sabi ko nga dito sa wall ko na to, kapag hindi siya nagagamot at may konting deviation na dyan, that is already the start of a symptom. So better na straight yung mga lines na yan kesa sa may putol. Kasi once na may putol, once may deviation, that's the start already of the symptoms.
Okay.
At baka hindi
And
na.
you can survive it. Kaya na i-survive, Ate B. Kaya actually you can go back to your old self, doktora.
Oo naman, hindi siya nakakaya magpatingin at di nakakaya na aminin kasi that means to say that you are really taking good care of yourself. Oo, hindi lang wag tayo mag-isip lang na kailangan gamutin ang hypertension natin o yung allergy natin. Hey, kung hindi gagana ang utak, hindi gagana ang katawan.
Yeah, tama.
And
how do you wean away from the medication, Doc? Sabi mo kasi pag ikaw ay diagnosed as having anxiety disorder or depression, kailangan mag-take ka ng gamot, di ba? How do you wean yourself away from that? Or ano na yan, para siyang maintenance, you will have to take it forever.
That's
as long as you live.
That's a very good question, Alvin. Para kang, di ba, kung na-diagnose ka with allergy, you still take your medications. Or when you're diagnosed with asthma, you take your medications, right? That's how it is also with depression and anxiety. Pag regular ang consults mo with your psychiatrist, you will form what we term as a very good therapeutic alliance with your doctor. And in that way, namo-monitor din, okay ka na ngayon na. Bawas na yung symptoms ng depression mo. Meron kasi kami may mga questionnaires kami that we use. Like the Beck's Depression Inventory para mabawasan.
You know what?
Mabawasan
It's like having a trainer. Parang na-realize ko the way you talk, doktora, it's like having a trainer. Pag sa exercise mo, meron kang coach. Sa mental health mo, meron kang coach. Yung iba, financial coach. So, meron nag-a-assess sa'yo every step of the way and will teach you how to go beyond it. Parang ganon, parang step by step.
That's a very good comparison. That is a very, very good analogy. Yeah. Kaya ang tawag doon life coach
Life coach.
Pero hindi, Doc, sorry, pasensya na, kukontra ko konti. Ang tanong ko kasi is gamot
Okay.
Ang tinatanong ko sa iyo is, kailangan bang mag-take ng gamot as long as the patient lives or na we win out siya dun sa gamot na yun?
I
Iba yung
will,
kasi, I can always, pag halimbawa, life coach, o stop ako sa life coach, wala akong pera eh. O di kaya yung trainer, wala na akong budget eh. Pero ito, pag sinabi mo ito ay lifelong, maghanap ka ng pera ngayon kasi kailangan mo ng gamot as long as you live.
kaya in-emphasize ko na once may konti pa lang na simptoma, kaagad magpatingin because there's a big chance if it is acutely depressed lang or acute ha, or kauumpisa pa lang ng sakit, pwede tayong maggamot ng 6 months to 1 year. May mga pasyente ako hindi na nagagamot, they just go and see me.
Ayun,
Yes,
ayun.
even
That's what I'm talking about. Ibig sabihin, pwede mong ma-overcome yung
Yeah.
gamutan na yung binibili mo na gamot, ano? Kasi kahit ako ayoko naman na for life, nagagamot ako.
agree.
Diba?
Ganito
Oo.
lang yun. Parang pag sa coach ka sa exercise, syempre may weight gain ka pa. So, madami pang mga exercises or machines that you have to do. Yun ang mga gamot. Yung in-explain ko lang kay B, yung comparison, no? May ang dami mo pang mga machines na yun din dun sa psychiatric illnesses. Kapag tumatagal na, ang psychiatrist, ipiprepare ka na babawasan ang medications mo at titingnan kung hanggang saan ka. Parang ganun din sa pag mag-exercise ka, di ba, bawas na rin yung machines or
Yeah.
sabihin natin, nasasanay na siya. Ganun din yung ginagawa, preparing you for your journey free of hassles. But,
Okay.
as I said, pero don't get me wrong, it will still be there. Depression.
So, ibig sabihin, pwedeng ma-trigger ulit.
Yes. Kaya,
So, nandun yun sa loob mo.
that is the reason why I wanted to emphasize, never ever miss your appointments with your doctors kasi may mga plano kami kung paano bawasan ng gamot, ano yung gagawin, or the support of the family, is it sufficient enough na, no? Mas ang daming mga anggulo, but there is hope.
Okay. Sige to. And lastly, bago namin kunin yung yung parting shots mo, paano yung may suicidal thoughts, ano?
Nako.
Kasi hindi naman lahat may ganun. Yung iba down lang, pero hindi naman sila nag-iisip na i-harm o i-hurt yung kanilang sarili. Paano pag may suicidal thoughts na how do you deal with it and also the family is dealing with it?
That is serious already, Alvin. You also have what we term as the slashers.
Slash, no? Oh.
Just hurt themselves or they would just overdose tablets, no? And they would say, I feel nothing. I feel empty. I feel... How do we deal with that?
Yeah.
Of course, it's serious kasi that means to say na wala na yung control nila over their actions. So, they have to be admitted in a facility for proper compliance of the medications and the treatment at para mabantayan sila 24 hours. Hindi pwedeng pabayaan. Kasi once na mga pasyente kami na gano'n, hindi pa okay, napabayaan, talagang they hurt themselves again.
Talagang mag-hurt na, no? Saan ma-admit? Kasi ang akala ng iba, sa mental health lang na-admit lahat ng may ganyang klase ng problema. Hindi po sa mga major hospitals. There are actually psychiatric wards, no?
Yes, for hospitals with psychiatric wards. Aside from the National Center for Mental Health, meron din tayo sa Medical City Ortigas, meron din tayo sa UPPGH, RM, okay, sa veterans, meron, madami tayong mga psych wards. At saka sa UST pala.
Okay. Doc, thank you, Doc. Maraming salamat. Thank you for your time. Ano po yung pinaka-advice nyo para sa ating mga kababayan to have a positive outlook? Yung next topic naman namin kasi pets naman. Kasi may mga pets na nakaka-happy, Doc, di ba? May pet ka ba?
I have 9 dogs.
Oh!
So,
so para sa'yo, therapeutic sa'yo yung dogs, Doc?
It is, and my
Nakakatulong siya
plants.
sa'yo.
And my plants. They are
Plants
very
naman.
therapeutic. Dogs and plants are very therapeutic.
Buti hindi ginangat-ngat ng dogs mo yung plants mo.
Oo nga, sinasaway ko nga pag lumalapit sa...
Doc, thank you, It's always nice to see you. Happy, positive yung ini-exude mong energy, Doc. Maraming salamat.
Yeah. Thank you so much
Thank
for
you.
caring also for our advocacy. Thank you.
And continue to be beautiful. And young looking. And
Gusto ko yan.
fresh looking. Ikaw, and the bangs. And the bangs. Thank you, Doc. Maraming salamat po. Dr. Bernadette Arsena po
Thank
yan, ang
you.
kaibigan nating psychiatrist. Thank you. You take care, okay? Next
May
partner.
pag-asa.
In-intro
May
natin kay Top. May pag-asa.
Yun
Alam mo,
naman
Ate
yun.
B, may isa akong kaibigan na parang, actually, hindi naman siya na-diagnose clinically. Kumuha siya ng cat. Ngayon, Diyos ko po, hindi niya na mapakawalan yung cat. Cat. Lahat ng mga pag nag-usap kami, puro cat. Sabi ko, pwede bang dog naman? No. Cat. Yes, you can leave na, Doc. Babae, oo. Puro cat. So parang naging therapeutic sa kanya yung pag-alaga ng pet.
And I think
So,
malaking bagay na gagawa po talaga ng mga pets sa ating buhay. In fact, tawag nga nung iba companion pets. Ngayong umaga, pag-usapan natin yan, paano tayo matutulungan ng having a pet para rin makatulong sa ating mental health. Madaming may anxiety. Si Dr. Andrea Bradshaw is in the house. Hi, Dr. Andrea. Magandang
Hi,
umaga.
Doc. You're back.
Oh, yes. Good to be back po.
So
sorry about that.
Is with us, an Animal House po yan, kasama ni Dr. Ed Unson. Doc, I was asking, Kako, may basihan ba yun? Bakit nakakakita tayo sa Amerika and even sa Philippines that some dogs are brought to the cancer ward o di kaya parang given to depressed people to perk them up? What is the medical basis for that?
Okay, so these are what we call therapy dogs, no? So therapy dogs, emotional support dogs, service dogs, these all cover different areas, no? So when we're speaking about yung mga cancer wards, yung mga hospitals who need this uplifting energy, no? Those are what we call our therapy dogs, no? This is because a lot of dogs, you hardly see a dog na malungkot unless may sakit. No, they're always happy to see people. They're always happy to be around people. No, so this energy, this very calming energy, helps also translate to humans and make humans also feel a little bit better. You know, may it be physical pain or emotional pain. No, they tend to help a lot.
So anong may basis? Ayan, nakita ni Doc si Lily, may may Shih Tzu din. Shih Tzu ba yan?
This
Shih Tzu
is
ba yan?
Lulu. Yes.
Ano pangalan niya?
Lulu.
Ikaw, Lily,
This is
Lulu.
Lily. Si Lily
Hi,
at si Lulu. Hi, si Lulu at si Lily, nakakatuwa, no? Anyway, Doc, ang tanong ko is, may medical basis ba yun? O parang hindi lang, positive lang talaga ang mga dogs? O talaga may effect? Talaga nawawala yung sadness ng mga pasyente?
Yes, there have been studies that do show that, let's say with depression, for example, no, that dogs really do help make people feel better. No, one way is, for example, no, during COVID, we have a lot of what we call COVID. Not only babies, also pets. No, because this is when people were feeling lonely. They needed physical touch. They needed to communicate. No, and pets really help with that. So there have been multiple studies done, which is why in different countries, these types of pets, these types of service animals have actually their own rights.
May rights din sila?
Yes.
Paano yun? Paano yung rights nila?
Yeah, like for example, service dogs, their right is to be in any public area. So anywhere that their owner is allowed to go, they are allowed to go. No? These are service pets are those who help with certain conditions. No? Let's say diabetic. No? There are some pets who are trained to smell if their owner is having high glucose levels or high blood sugar or low blood sugar. And they can alert their owner if they need to eat something sweet to help bring up their blood sugar, or if they need to take their insulin para bumaba naman yung blood sugar nila.
Kaya nila yun? Kaya nila i-detect?
Yes, kayang-kaya nila. Yes.
Okay. Sa Pilipinas, Dog, pinapractice na ba yun? yung mga ganyan? O abroad lang yan?
Unfortunately, we don't have any laws surrounding people with disabilities who require service pets. So hopefully in the near future, people are being more open, and people are much more loving towards pets now than they were 10 years ago. So hopefully in the near future, we'll develop some laws for that naman.
Ibi?
So service dogs para sa may diabetes, service dogs para sa may problema rin sa paningin, ganun ba? Pwede
Yes,
ba yun?
so service dogs, they are defined by having to perform a specific task.
So ginagamit din yun kapag may problema sa paningin. Ano pa? Diabetes, para sa mata.
Diabetes, blind, deaf, anxiety, pwede rin. Yes, so they can alert when anxiety attacks are going to come on. They can give what we call pressure therapy, which is where, for example, for an anxious person, they lie down on the person. That helps with their breathing, helps with their heart rate.
Talaga, marunong ng ganon? Ang galing.
Yes. And they also fall, yung mga bomb sniffing dogs, they also fall under this category.
Yeah. And also pwede din yung pambata, parang to guard the kids. May mga ganun bang klase ng dog?
Well, that is not actually considered a service animal, because if we service animal in a different sense, these service animals who are allowed to go into open public areas, they need to be able to be calm. They need to be able to basically keep their cool around stressful situations. These are not the type who would be guard dogs. Those who are made to protect children, those are most likely going to be within your own home. Because you cannot have a aggressive dog out in the public. Kasi baka naman, something might go wrong, and then might mistake one action for being bad when apparently they didn't mean any harm pala.
Yeah.
So may training yan, Doc,
Yeah.
Yes, so ever since puppies, selection already starts. So as early as 6 months, they start, from birth, start with basic obedience training until about mga 6 to 8 months. 6 months pataas, that's already the part where they have to make sure that they don't get distracted by anything. So when these service animals are out in public, they're working, which is why they advise na do not pet these service animals, because they are on high alert for specific conditions for their owner. We don't want to distract them away from their work. So as early as 6 months, that type of training already starts, and then from there, you have to determine kung ano yung strength ng puppy na yon. Is this puppy good for stability? Malakas ba yung dog enough for you to put your weight and lift yourself up in case of an accident? Is this dog good at retrieving? If they're able to get yung mga gamit ng mga owner, kasi may people with disabilities who cannot use their arms, for example, opening doors, ganyan. So as early as 6 months, they'll already be able to parang distinguish what type of service a certain pet would be good for.
Yeah, tama. So ibig sabihin, it starts with a puppy. Hindi pa pwede, kagaya si Lily. Lily is already 2 years old. Hindi pa pwedeng adult na. Kailangan bata pa.
Adult dogs are okay for therapy pets. Adult dogs are a little bit harder to train in terms of service kasi they need this core, service dogs require this core knowledge. As early as puppy, they've been training. Therapy dogs naman, in terms of for emotional support, mental health, those who go visit patients in the hospital, human patients in the hospital, can start as adults. So if your dog is calm, if they do not get agitated by certain situations, if they can, if they know the basic obedience training, sit, stay, down, they don't lick too much.
Lily, hindi ka pwede, you lick too much.
Yeah, so there are actually, client actually ni Doc Onson is part of training doctor dogs. These are therapy dogs that go to visit hospitals.
So nagtitraining kayo dyan sa, sa Animal House ng doctor dogs?
Well, we don't exactly have that training, pero Doc Onson does have a client who does that training.
Okay. So may breed ba yan, Doc? may mga breed ba na parang, uy, ito bagay ito sa service dog. Ay, ito very sa therapeutic dog.
Okay, yeah. So the specific breeds, any breed can basically be a therapy dog, can be a service dog. No, it's just you'll notice that even if we aren't training them for these types of situations, different breeds have different personalities born with them. No, you'll notice golden retrievers, Labrador retrievers, very friendly, very
Gentle.
high energy. No, Belgian Malinois, German Shepherds, they can be friendly as well, but they have this instinct for a little bit of an aggression, no, which is why they are used for police dogs and bomb sniffing, because they can act when they need to. No?
Dun sila
However, don't
bagay.
get me wrong. Yeah, don't get me wrong. These pets can also be used as therapy dogs. No, it's not. We don't want to give a stigma to every certain breed. It just so happens that certain breeds have these certain personalities. So yeah,
Tama.
any dog can be a service animal. Any dog can be a therapy dog. There are just some who are born with more innate, personalities who would be a little bit more suited for the job.
Yeah, I get what you're saying. Na may aso kasi una-una iba intimidating kasi, no? Parang
Yeah.
pag nakita mo pa lang, naku, manlalapa to, hindi naman. Ang sinasabi ni Doc,
Don't get me wrong. I mean, I have that
Oo.
type of here in the clinic also. Mukhang this dog wants to bite,
oo. Pero mukha lang. Mukha lang. Pero kagaya
Yeah,
ng mga Doberman, halimbawa, nakakatakot, di ba? O Rottweiler,
Yes.
halimbawa. Pero they can also be service dogs or
Speaking of
therapeutic dogs.
Rottweiler, I have a patient na yes, whenever he's in the clinic area, people kind of take a step back, no? But sweetest dog si Willow. Shout out kay Willow.
Talaga, sweet.
Mm.
Hindi nakakatakot.
So
Nakita ko
sweet,
na, pag
so
may
sweet.
Rottweiler, atras ako doon,
Takot ako.
kitakot ako sa Rottweiler.
People tend to cross the road, no?
Yeah.
Oo.
What to be?
Doc, may banggit ka, therapy service. May isa ka pang binanggit kanina. Ano yung,
Emotional support.
ano naman yun, Doc?
Yes. So emotional support is, for example, I would say Lulu is my emotional support dog, no? Because in times of anxiety, in times of stress, she helps me calm down. She kind of grounds me, no? I just claim she is my emotional support dog because this actually requires diagnosis from a licensed physician, saying that you have anxiety, that you have depression, and that you require this type of care, no? That this dog can give you. Now, we were talking about if the Philippines has laws. Unfortunately, it doesn't. The Philippines doesn't. But for example, certain airlines, they accept service dogs to be with their owner in the cabin. No, as long as they are service dog, they can be in the cabin if they are performing a specific task.
So may certificate yun na ito service dog ito, may proof ako from a reputable.
There are
diba?
certificates. Yes, but for example, in the US, you don't require a certificate. No, as long as the dog as long as the owner can tell you their disability and the task that the dog needs to perform, then they're allowed to be in public areas.
So hindi ka pwede mag-refuse. Halimbawa, airline ako. No, dogs allowed in the cabin. Pwede mag-insist yung pasahero na, no, I need that dog beside me during the flight.
Pwede sila mag-resist ng accompaniment of your pet if may mga signs ng aggression, if they are disrupting yung environment. Because service dogs would not do that.
Paano yung emotional support dogs?
Now, unfortunately, emotional support dogs do not have this privilege. No? So emotional support dogs do need to be, for example, they cannot come into a no pet zone. Groceries, no? They do not allow pets in the groceries. Bawal sila doon, no? Whereas yung service dogs, pwede sila.
May certification ba yun, Doc? Na service dog ako?
There are certifications, no? A lot of the patients here who are flying out of the country, for example, have certificates saying that I need this dog in the cabin with me. So we use that as part of their requirements going into their travel.
Okay, okay.
Okay.
Pero hindi pa yan
Eh,
accepted ha, dito sa atin. Dahil alam natin, marami pang mga lugar na basta no pets allowed.
Yes, unfortunately, oo. Soon that will change. Sana.
Oo,
Yeah.
oo.
Hindi, tsaka unti-unti na eh. Dati, yung malls, kagaya ng SM, dati bawal yung pets eh. Ngayon, pwede na sa SM yung pets,
Yes.
ano?
Oo.
Ayala Malls, pwede na. I think,
Food.
Service
Mm-mm.
Malls
Food
also.
rin, yeah.
So, kumbaga, nagsisimula na ang acceptance kasi ang
Yes.
dami na ring may pets. Di ba, Doc?
Yes, oo. Like I said, 10 years ago, completely different situation than what we have now. Now, people are more accepting of pets in public spaces now. A lot of people actually enjoy it. You'll notice you bring your dog to the mall and, ay, ang cute!
Pero Doc, ang tanong, gusto ba ng pets yun? Let's talk about that. Balik rin natin. Yung point of view naman natin is from the pets, ano?
Yes.
Do you think gusto ng pets yun? O hindi, actually stressful sa kanila yun kasi may hangganan yun eh, na parang, ay, ang cute-cute mo, Lili. Eh, lahat na lang gumanon sa kanya. Hindi ba stressful sa aso yun, sa pets mo?
It can be stressful, no? But just like humans, each pet has a different personality. So some pets would enjoy that, some pets wouldn't. No? So you as a pet owner, when you take your pet out, if they're stressed by cars, no, if they're stressed by loud noises and by a lot of people, you need to be naman yung emotional support for your pet and ensure them that this is a safe area.
Yeah. O yun, sinasabi ko.
Ka-
Yes, kagaya din
Parang
sa...
one-on-one, masaya siya. Pero pag marami ng
Oo.
taong...
Pag marami na, oo, may
owner,
stress na siya.
oo.
It's a give and take
Kawawa
naman.
naman.
Give and take. Oo.
Pero yung sa service, Doc, sa emotional help siguro, Doc, pwede, no? Pero yung halimbawa service dog siya, how do we ensure na hindi naman a-abuse yung service dog? For all we know, baka pagod na siya, pero hindi. Mag-amoy ka pa rin doon, magtrabaho ka pa rin. Pero baka pagod na po siya, kawawa naman po.
Yeah, well, syempre, when you're out in public with your service dog, no, you need them. No? They're not running around picking up, all of these things. No, they're not exerting too much energy. They're just on high alert. No, high alert for whatever task they need to perform. No, so whenever you're out and about, they know they're in work mode. They have been trained for this. When you're at home, they can kind of release that. No,
Relax.
okay, I'm a dog again. Run around, sige. But once my owner says that they need me, back to them.
Yun.
Yes.
Yun.
So
Ayun.
Seven.
yes. Pets actually love they love making their owner feel good. So you are getting what you need from this pet, no? And at the same time they are feeling this sense of accomplishment. No?
Yeah.
So they actually enjoy it. No? A lot of the times they do enjoy performing the tasks that they need to.
Okay. Now, we have 4 minutes left. Let's talk about training. Is it hard? Kung halimbawa si Lily, gusto ko si Lily ma-train naman ito bilang service dog. Halimbawa lang, o di kaya emotional dog. O ano yung isa? Emotional dog, therapy dog, and ano yung isa?
Service dog, emotional, and therapy.
Yan, okay. So if he needs or she needs training, paano yan? Anong magandang suggestion mo? May training school ba sa Pilipinas?
There are different organizations. One that I'm familiar with is Ateneo, no? Where they do see, you can bring your pet there. They will assess to see if this pet is able to stay calm in large crowds. If they have any tendencies, there are some pets kasi na okay sila pero may trigger tapos biglang they'll kind of maybe snap, no, or run, no. So they need to be able to stay calm in those situations. So for example, therapy dogs, I'm getting distracted by Lily, ang cute niya.
Nagpapalambing yan to eh.
For therapy dogs, no, it's more of an assessment to see if they're fit for that type of situation. Training starts even when they're kids, but that's even when they're puppies, but that's more on the owner's end, no, the basic obedience training. And then when they're older, because sometimes we don't know that this dog is going to be an emotional support dog or a therapy dog, no, it just so happens that they bring you peace, they bring you comfort. So at certain times, you kind of want to extend that towards your fellow yung friends mo, whoever needs that support. Take your pet into whatever organization accepts these for therapy dogs, doctor dogs, no? They'll assess, see basic obedience training, if they have any triggers, if they're able to stay calm, dapat they do not lick, they do not bark, no?
Lick. Lick,
And
lick,
then
lick,
if they cover all of those things that they need to, these traits that they need to have, and then they can go ahead and be a therapy dog. No?
Ay, teka muna, ba't
Service
mo
dog
nabanggit
training
yung
is
licking?
completely different. Sorry?
Doc Andy, explain mo bakit bawal yung licking? Ito mahilig mag-lick. Ewan ko si Uni kung bakit bawal ang licking? Uy, makinig ka na nagdi-discuss ito.
Sometimes you take your pet into or you take a therapy dog into a hospital. Bawal yan, Lily.
Lily, bawal ka. Oh.
You take your pet into the hospital to be a therapy dog. If they tend to lick the floor, no, although hospitals try to stay as clean as possible, there's always a possibility for cross-contamination. And a dog's tongue can be one of those sources. No? So lick the floor, go to see a cancer patient who is immunosuppressed, no? Mababi yung immune system nila, and then the pet licks, baka naman mahawa sila ng something. No? So kailangan, as much as possible, limit yung possibility ng transmission ng anything.
Tama
So
naman.
how can I stop Lily from licking? Meron bang technique dito? Lily, akin yung dila mo. Sabi ni Doc, huwag kang lick.
That is part of obedience training. No, usually we would address that as puppies.
Puppies pala
Hindi na
matanda.
puppy. Wala na. Anyway, Doc, ang dami namin natutunan. Ate B.
May tanong.
You can always teach dogs new tricks.
Ayun, ba? Nice
Doc,
one.
yung sa Ateneo, may bayad ba yun?
As far as I know, wala. No, because you are actually providing them with the service. No, that your dog is if they pass the tests, no, then your dog can go ahead and serve other people, which is what they are pushing for.
Ang tanong, si canine dogs po ba considered daw as service animals?
Canine dogs are considered as service animals because, again, they are required to perform a certain task.
Okay. Doc, may mga dogs na nire-retire. May edad ba sila na dapat tama na, nakapagtrabaho ka na ng husto?
Yeah, usually once you start seeing, it's not really age, no, because sometimes some dogs can stay healthier, they look much younger than other dogs, no, even though same age sila. Because pets are also predisposed to mga arthritis. No? For example, yung mga bomb-sniffing dogs natin, they can't continue walking around, they can't continue, or yung mga canine units ng police. No? Once this arthritis starts kicking in, once they have, let's say, a kidney problem, a liver issue, which is compensating sa task nila, it's about time to retire them, let them enjoy the rest of their life as they would as a regular dog.
Yeah. And you can actually adopt. Diba?
Yes.
You can adopt actually a service dog.
Exactly.
Huwag ka nang bumili partner o huwag ka mag-alaga ng puppy. You can try adopting it. Kasi sanay sila sa rigid. Maninibago ba yun, Doc? Kung sanay sila sa rigid life as a
they will still require kasi they're used to expending a lot of energy in one day, no? So once they're retired, they will still need their regular walks, the regular playtime, no? Which you will need to provide for them din naman, no? But at least kapag ganyan, they can stop whenever you can see they're feeling tired.
I have a question.
Okay.
So, pwede bang bumili ka na lang ng service dog kung kailangan mo? Pagdating sa'yo, trained na?
Yes, actually, there are organizations, for example, in the US, where service dogs are really required and they really help out, no? Where they start training these puppies, on their own, and then these humans who require these specific services will come to them and say, "This is what I need. Would you have a dog that you could recommend?" Most organizations are non-profit. So they do this, you don't buy them, no, it's basically adoption. no, but you need to require their services because again, you want these dogs to go to owners who actually need them and who will use them to the best of their abilities.
But in the Philippines, wala pang ganon.
Wala pa, unfortunately.
Wala
No. Again, I've had a couple of clients who have been trying to get their dogs to become service dogs, but they have to send them abroad for the training because we do not have specific or not well-known organizations yet who do tackle that type of situation.
Okay. Doc, may nagtatanong, pag ikaw daw ay may aso, okay lang bang dalhin yung aso mo to cheer up a friend?
Oh,
Pwede
yes.
naman.
Oo. Yes. Oo. So, ako personally, si Lulu, she's actually very calm in stressful situations. And I do have a couple of friends who do require emotional support, no? A lot of which who have seen Lulu decided to get dogs to try it, no? And this has actually helped them a lot because like Doc was saying kanina, minsan, when you're diagnosed with depression, you don't have this will anymore. You don't have interest anymore to do these certain things.
Yeah.
You'll stay indoors for long periods of time. But when you have a dog who wants to go outdoors, it will kind of force you to step outside, no? Being outside really helps with yung emotional health, no? So that's one way na, pwede, no? So even if your dog is looks to be good at this, they can help whoever your friends are. Why keep it to yourself when they can help so many people?
No, but it doesn't mean you can't get a cat. A cat also has that ability to cheer you up, or dogs lang yun?
Yeah. No, cats also. Cats are completely different though, no? They are more like people than they are like dogs, no?
Yeah.
Now, unfortunately, in the US, cats are not exactly actually in airlines pala, cats are not actually noticed as service animals, no? But emotional support, therapy, yes, very just a quick fact, no? Fun fact. Cats purring, that sound that they make when they're happy, that has a healing vibration. That frequency is healing. Yes. So you'll notice minsan kapag may sakit sila, nagpa-purr sila. Doesn't mean exactly that they're happy. Or if ikaw yung may sakit, they'll sit on your chest and then purr, no? Because they want to give you these good vibes, healing vibration.
You also have cats? May cats ka rin,
yes.
Doc Andy?
Yes, too many.
Hindi naman nag-aawa yung cats and dogs mo.
Hindi naman, no. They're all friends.
Galing.
That's good. Anyway, Doc, thank you very much for your time. Pangatlo mo na ata sa amin, ano? Ang dami mo ng guests. Second na.
Second pa lang naman.
Fourth time pa. Please extend our thank you to Dr. Ed, okay? And of course, Animal House. Maraming salamat.
Can I get one thing in before I go?
Of course.
Okay. Let's not neglect yung mga Aspins natin. Aspins are very good emotional and therapeutic dogs and working breeds also, no? So, whenever you get the chance, let's go ahead and rescue a Aspin. They're very, very gracious, very thankful for you rescuing them, and they will return the favor 10 times.
Thank you.
Oh, that's good. Tama yan. And if you want to see Doc Andy, nasang branch ka, Doc? Matatagpuan.
Makati po.
If you want to see you. Sa may Jupiter?
Yes po.
Ayan, kita-kits.
Bisitahin niyo si Doc doon. Yung mukhang Amerikana doon, siya yun. Dr. Andy, thank you. Maraming salamat. Bye-bye.
Yun usually yung description sa akin. Bye-bye. Have a good day po.
May lahi. Si Dr. Andrea and the Bradshaw. Ang ganda pilito, di ba? Maka-Bradshaw naman. Thank you.
Galing. Diba? So, ang
salamat
alaga
po sa
natin,
pag-monitor.
emotional support lang, Vin. Ang uni at Lily. Oo.
Yeah.
Pero, pag na-try
bawal
natin...
pa kasi mahilig ng dila eh.
Hindi tayo
At least
pwedeng
si Uni ba dila ng dila o hindi naman?
Hindi niya didilaan yung mga strangers. Ako lang.
Hindi ako. Ikaw.
Oo. Okay lang sa akin. So, pwede siyang therapy dog. Pero ayaw niya ng matagal. Oo. Kita ko yun eh. Ano to, Snabera actually.
Snabera. Bratinela pala yan. Si Lily wala kahit sino to. Didilaan niya. Kaya pwedeng kidnapin to eh. Ano ko yung si Lily. But please, love your pets. Ano po, kinuha natin sila as pets, ha? Ayun, huwag nating abusuhin. Mahalin natin. Sabi nga ni Doc, 10 times, baka 100 times yung ibabalik niyang pagmamahal sa iyo. Be it a dog or a cat or whatever pet you have. Kahit ahas yan, di ba? Maraming salamat po sa inyong panunod sa amin. Thank you po. Si Alvin Elchico po ito. If you
Sana
like,
mo-
partner, paano yan?
If you like our episode today, like, share, and subscribe to our channel. Ano? Para kahit pa paano makasend rin naman tayo ng good vibes ngayon. Okay naman ang pakiramdam nating lahat. Ano? Di ba? Dahil importante po ang mental health, di ba? I-send yan sa inyong mga friend. Ulit-ulitin ninyo ang episode na ito at i-click yung alert button. Yun, para pag may episode tayo, alam nyo na, nandito na po kami ni Alvin. Ako po si Bernadette Sembrano-Aguinaldo.
Bye! Hanggang sa susunod na episode ng
Thank you, Doc.
Thank you, Doc!
Bye-bye.